probably one of the biggest things that did come out of that is that the best response was with medication. The people that were getting therapy alone didn't generally do as well, unfortunately. I still encourage people, even if they're doing medication, to do therapy together with that, because other studies have shown that we can usually maintain them on lower doses of medication if they're participating in therapy. So a lot of times I'll really encourage the people that I see to participate in therapy as well, because I do tend to be a minimalist, and I don't like, which may be surprising, to necessarily have people on a lot of medications. So,
would you, I didn't catch, you said you don't normally make those recommendations, but do you have a list of sources for interventions in the classroom?
I used to. I've moved offices a few times and unfortunately just moved here fairly recently, so I don't know if I could put my hands on it, but there was one that I had here fairly recently that I thought gave a really pretty good list of the interventions that a typical person with ADHD would benefit from, interventions within the classroom. Some of them included, obviously, minimizing distractions, having the person, the smaller, generally, and a lot of times, this is something that I'll hear as I'm taking the history. It's like, well, when I work with them one-on-one, he's fine. And that's true. That is very true. With a child who has ADHD, if you're giving them one-on-one attention, they really don't have that opportunity necessarily to get distracted. So obviously, the smaller classroom size that we can have that child in, the better. So that's usually one of the things that you'd probably see on that list. A lot of times, they will need a little bit more time maybe processing information, so giving them more time on timed tests, things like that. So I'll see if I can't relocate that list, and I can email it to Dave and let him get it to you. But there are certainly some good lists out there.
What about adult ADHD? Do you have testing for that? Or are you very familiar with the adult?
With the adult version, since I do primarily work with kids, I don't necessarily see a lot of adults. I do see some who have ADHD. A lot of times what I'll look for, and I don't think I mentioned this earlier, but with our criteria under DSM-4, generally some of the symptoms have to have been present prior to the age of 7. Now, if you're seeing an adult who can't necessarily remember quite all the way back there, but you're still hearing about a lot of those similarities in that criteria, I certainly wouldn't necessarily hesitate to diagnose it. And there's the DSM-4 is a fairly forgiving manual, and if you can't have somebody necessarily meet all of your criteria, they generally do allow what we call a not otherwise specified modifier. So, if a lot of those symptoms are present, but I can't necessarily get it to specifically meet that, I certainly can diagnose ADHD not otherwise specified. Most of the adults that I've seen, we have been able to tease things out enough so that they do actually meet the criteria. Testing isn't something I specifically addressed necessarily. There certainly are a lot of checklists that are out there that are used. Even more specific than that, we can do things such as a TOVA test where they have to sit at a computer, and it can be a rather boring test, which is part of what we want because we want to see how they do sustain their attention with something that's a little less fun. Because a lot of times, as I'm taking a history, I'll hear, well, they can play their video games for hours. So, I don't understand. And it's like, well, if you really think about a video game, the stimuli of that video game is constantly changing. That input is changing all the time. So for me, that's not an accurate measure of how a person can sustain attention or not. But a TOVA test, it's, very boring, same thing, not exactly the same over and over, but it'll measure, and it takes a bit of a snapshot of how well a person does with sustaining their attention. So that can give us if I have somebody where, there's a little bit of a question, I might ask for that to be done. If I'm concerned about some of those other comorbidities that we talked about, I may ask for some more further in-depth psychological testing. If I do have somebody where I'm concerned about their brain, seizures, or if there's been a history of a brain injury, obviously I'm going to get a neurologist involved and maybe ask for even more specialized testing, such as neuropsychological testing, where it actually looks kind of at how the different areas of the brain kind of come together and talk to each other, so to speak. Did that answer your question?
Well, my son is 41, but he seems to have me everything. But I went with him to a psychologist, and he said there are no tests for ADD. In fact, I don't even believe in it. And then later on in the conversation, he told us his daughter's on medication, his 4-year-old daughter. But he said there's no testing tools.
There's not anything that can, in ways, right. I mean, a lot of the tests that are there are more kind of screening tests, and you have to use it in conjunction with a clinical exam and asking about symptoms. So, there's certainly not a blood test, or, I think some people were talking about, and some of this is true, there can be changes that are a little more indicative of ADHD, such as on an EEG, but by itself, it's not necessarily a diagnostic of ADHD. You have to put it together with your diagnostic interview and your clinical exam. So in that case, that's a fairly inaccurate statement, but if you have a clinical interview and you have a test that's like the TOVA test, which has been out there and around for years, where there's a certain, there's a high indicator of the potential for ADHD, then the likelihood of it being present certainly is greater.
Yeah, he's very hyper, and he'll start everything, but maybe finish nothing. But he'll get it started. And then he is hyper, and he does
Talk a lot.
I've done some reading on children who are ADHD but not medicated, and I've read, there's so many different things out there, high protein diets, teenagers that take coffee breaks in high school, because of the caffeine to help them. What are your feelings on those in general? Have you ever seen anything that does help, that's not?
Talk about the caffeine addiction and the alcoholism.
Because I've always heard, I'm a reading recovery teacher, and I actually had our reading recovery teacher leader who had a child who was so hyperactive that he could not remain in the seat long enough to conduct the lesson. And so she would have him drink a can of Mountain Dew prior to the lesson, and she told us, the class, that it was beneficial. I don't know, I've never tried it. I would not feel comfortable doing that without, consulting with a parent.
Right. Well, we do know.
And it also scares me, because I thought if they're already not sitting in the seat, I'm afraid they'll be like hitting the ceiling or something. Is there any research that shows that those kinds of things are helpful, or is it just